Hello and welcome back to another case which I still remember in my practice many years ago. This lady came to me for recurrent epilepsy and she was being treated for this epilepsy with a lot of medicines, the anti-epileptics, and the epileptics helped her to an extent, but it would not go. We investigated her and found that she had a granuloma of the brain. And granulomas are because of the past infections. And we found that she had a history of tonsillitis and tuberculosis in the family. And that had resulted into the granuloma. The obvious cause, the way it is. She was already treated with anticox, but her cox had disappeared, but the granuloma stayed. And due to the pressure symptoms, she used to develop epilepsy. When I took her case, she was constitutionally silicea, and we had given her basilinum as a nosode, which acted as an anti-miasmatic and also a pathological simulimum. And after maybe a period of 6 months or so, the granuloma regressed. Over a period of time, the granuloma disappeared. The silicea acted well. Her silicea anxiety, the perspiration that she used to have, the performance anxiety disappeared. While leaving, she asked me, what is something that I should do? And I still remember I told her that never come first in the class. In the history, she had mentioned this, that she was a topper all throughout. Right from her first standard till the time she did her engineering, she used to top. She never left her first place any time. I had basically cracked up the case by this particular desire to be first. When I asked her this, she had distinctly told me it is very important to see that everybody around me is happy. I am only happy when my parents are happy. I am only happy when my teachers are happy. So I will do anything to live up to the image which my parents have about me. I will do anything to live up to that standards which the teachers have set for me. And throughout this case, she had this habit of to living up to somebody else's expectations. This and with other symptoms of the Rotary and the silicea as a constitution, we prescribed this silicea. When I long pondered over this case, one thing that came clear to me that her aspiration to live up to somebody's expectation was her biggest obstacle to cure. We have already treated her anti-miasmatic. Then why does she actually still want to be the first when she always stood first and the same thing was not needed hence more? This quest now, when she grows up, gets married, will get transformed into to be the best wife, to be the best daughter-in-law, and this never ends. And this thing to be the best, we feel is a virtue, but basically it is not. It is that venomous thing that creates another state within us, and this is the state that keeps us diseased, because we nurture a particular kind of delusion, or what we call as an adaptive response, which we found ourselves in the best state after adapting to it and got whatever we wanted. That was the story. She stood first all throughout her career. She made her parents happy, but she got now affected by this response to the extent that she was trying to use it everywhere, wherever she went, right in her profession, in her relationships, in her studies. And that's the reason I told her that don't ever come first in the class, or don't ever try and top. She had never understood it at a time when I told her. After a few months, or maybe after a year, when she came and the treatment was about to be stopped, I asked her, how are you feeling? The first line she said to me is that I feel much relieved after I listened to your advice. I said, what did I tell you? She said, didn't you tell me not to come first, not to try too hard? I said, I guess I remember. That is the first thing that I followed, sir, because I found that was creating a kind of pattern which was stressing me a lot. I followed it really to the core, and now the first thing that I feel is I feel myself. I no longer feel burdened with somebody's expectations. I no longer feel that I am doing something which I do not wish to do. Now, this was a big follow-up for me, not in the terms of the pathology disappearing, but this was a more important follow-up because this person returned back to himself, basically herself. And silicias, they have this pattern. You must have seen them in your practice. They always want to be the best. And when you tell them that this is no longer needed, they will actually grumble. They will actually come to fight with you, because for them this was one thing that made them what they really wanted to be. They got their image, their status, because they really achieved the whole achievement by becoming the first. by becoming the best, by making people happy. But was it really needed? If you ask them, they will say yes, it is needed, because for them making people happy becomes a way of life. But can you really make everybody happy? The moment she goes into a marriage or any relationships, she understands the biggest turmoil of it. She tries hard because she wants to make herself again the best wife or the best daughter-in-law. And it does not happen because it's human mind. You ask for one thing, you do it, then you'll ask for another 10. You do the next 10 things, the mother-in-law will ask for another 15. It goes on and you get emotionally drained and even strained. Your quest to be the best daughter-in-law or a wife doesn't ever succeed, and then the disease starts. And that's the reason when it is Sirisha, I always tell them to let go of this idea of becoming the best, to let go of this idea of being what you really want to be, and to make others happy, and try to be what you really want to be. If this advice of telling them to be what they want to be and rather to make them do something to make others happy has been the best statement for every Sirisha patient to transform them. I have seen Sirishas then go into the role of creativity and the role of authority very soon. They leave this typical turmoil which they have, their emotions which get stuck in the relationships, and much have a freer life than what they are having now. So with this advice, this patient freed herself, and there were many cases of Sirisha which got out of their main problems. What I could see is it is not only the physical complaints that disappeared, but all these people evolved to the next level. They never wanted to be the way they were because they then realized that how stuck they were in their lives. So, homeopathy is not only about silencing the symptoms. You can change and transform and evolve. Try it this way. It will really make a difference to you and your patients too.